Which of the following is an organizational factor that affects workplace violence directed at nurses? A. Clients who have short hospital stays. B. The presence of security guards. C. Restricted client areas. D. Understaffing of nursing personnel. The answer is D. Understaffing of nursing personnel. Understaffing of nursing personnel may be an organizational risk associated with workplace violence for nurses. Understaffing involves too few nurses on duty, which may not be enough to meet client needs at the time or may result in longer delays for provision of care. Greater amounts of activity and diminished numbers of nurses to provide care may result in aggression, violence, or anger from clients or families directed towards staff. A client has been diagnosed with a form of terminal cancer and has started receiving hospice care. The nurse notes that both the client and his family avoid talking about the diagnosis. All attempts at discussion result in changing the subject. The nurse recognizes that this family is exhibiting A. Closed awareness. B. Mutual pretense. C. Open awareness. D. Powerless assessment. The answer is B. Mutual pretense. Mutual pretense is a form of awareness as a response to death or dying in which those involved avoid discussing the situation. In a case of terminal illness, a client and his family are aware of the diagnosis, but the client may not want to talk about the situation for various reasons, such as saving his family from feelings of grief, fear of the future, or discomfort with talking about feelings. A nurse is preparing to talk about body changes with a client who just had a bilateral mastectomy. Which of the following actions of the nurse is most appropriate during this discussion? A. Provide a room that offers minimal distractions. B. Ask closed-ended questions to allow the client to think about her situation. C. Write detailed notes during the conversation to track important information. D. Ask personal questions about the client's background to determine how the procedure has affected her. The answer is A. Provide a room that offers minimal distractions. When preparing to talk with a client about a difficult subject, the nurse can provide an environment that is private and that offers minimal distractions. This gives the client an opportunity to open up about personal feelings without being interrupted, and may provide more open communication between the nurse and client. A nurse is attempting to speak with a client about his personal feelings of self-esteem and self-concept. Which of the following questions is most appropriate for assessing a client's personal identity? A. What is your educational background? B. Are your parents still living? C. What do you like about your life right now? D. Where do you see yourself in 10 years? The answer is C. What do you like about your life right now? When assessing a client's personal identity, the nurse should focus on questions that determine how the client feels about himself. This may mean asking questions that help him identify his personal strengths and weaknesses, as well as how he thinks others see him. A drug form in which medication particles are instilled into a liquid and combined through agitation of the solution is called A. Suspension. B. Elixir. C. Syrup. D. Tincture. The answer is A. Suspension. A suspension is a type of medicine that combines medication particles with a liquid solution. When not administered, medication particles within the suspension may settle to the bottom, requiring the nurse to shake the solution to mix. Suspensions are typically given as oral solutions.